What is dialectical behavioral therapy and why do we use it? Dialectical behavioral therapy, in short DBT, is a evidence-based treatment approach that was initially developed to treat severe and chronic mental health disorders. Now, in today's world, DBT skills has shifted and expanded and shown to be effective in kind of well outside the traditional framework, and it seems to benefit a wide variety of mental health diagnoses, conditions, and symptoms. So it really has proven to be effective for just about anyone and everyone, which is why we utilize it. One of the core concepts in DBT is right in the title, and it's really important to understand and kind of hold as we're working with DBT skills, and that is of dialectics. Dialectics are two seemingly opposite things that can both be true at the same time. The main dialectic within DBT and really in therapy of itself is that of acceptance and change. And so it's the idea that we can accept ourselves and who we truly are, and also look for ways and have a goal of changing our actions, our emotions, and our thoughts. Now, these skills are not mutually exclusive, and so we are more effective in reaching our goals if we hold both of those thoughts at the same time. Again, I accept who I am, and I also understand and want to change who I am and how I function and my thoughts and feelings. So in DBT, there are 4 different modules that address different aspects of overall mental and emotional well-being. And so we pull from all of those 4 modules in order to really focus on different aspects, especially because it works really nicely because group in the group sections really also focus on different aspects of just general emotional and mental well-being. And so it pairs really nicely with DBT in the different modules. The first module is really the cornerstone of DBT, and it's a module in and of itself, but it also kind of uses the skills throughout all of the treatment and all 4 modules because it's such an important piece, and that is of mindfulness. Mindfulness is all about being present in the current moment by focusing our attention on the here and now. It really helps us to kind of slow down, be more conscious of how internally we're doing, externally, the overall environment. It helps us be less impulsive and irrational when we are acting upon our thoughts or behaviors or just different situations. And so it helps us kind of proceed and act more effectively and aligned with how we're feeling and our goals as well, and we'll kind of reach our goals the most effective in the most effective way. The second module is the stress tolerance. Now, this is all about getting through the moments of intense emotions, and so we use the stress tolerance skills when the emotions have completely overwhelmed our ability to cope in the moment. And so we need some skills in order to survive and get through the super intense distressing moment. And so it's really just crisis moment skills. They're not meant to be used just sparingly and proactively trying to kind of manage and cope with stuff. It's really just crisis situation, use these skills. The third module is emotional regulation. This is where you're a little bit more proactive, and this is the emotional regulation skills are outside of the moment skills. They're all about identifying, understanding, adjusting, and just managing our emotions. And so these skills help us understand the purpose of emotions in general, and then learning ways to cope with feelings, and especially the uncomfortable, distressing feelings. The last module, the fourth module, is interpersonal effectiveness. This module focuses on learning how to navigate relationships. These skills really help us to communicate with others, communicate our needs more effectively, manage conflict, and then create and maintain healthy relationships. So it's really cool because, again, relationships and getting along with others is a big aspect of being human and really being part of life. And so learning those skills obviously is a big part of our emotional and mental well-being. So similar to cognitive behavioral therapy, these are skills that require a lot of practice. And a lot of mental effort. And so we teach them and we learn the concepts and the skills and the overall ideas in group. However, group members are then really encouraged to practice and further talk and explore with family members and people around them and in their life the concepts and the skills, because they're going to need to practice that to strengthen their skills and really truly have these skills part of their toolbox. Just learning about them once a week in group is definitely not going to be enough and be effective in make them effective in utilizing these skills. This is something that needs to be practiced on a daily basis, because these are difficult skills for us to utilize as adults. So kids are definitely going to need a lot more support and practice in order to really strengthen, again, the skill and being able to actually utilize these skills in the moment when needed.